Emergency postcoital contraception. So, the emergency postcoital contraception, often referred to as morning after pills, it is needed after unprotected voluntary coitus or involuntary situations such as rape. So, the emergency contraception is a birth control measure used after sexual intercourse to prevent pregnancy. And there are different forms of emergency contraception. Here are the two types of emergency contraception. We have the high-dose progestin-based pill, the one that we called morning after pills, and the insertion of a copper IUD. This kind of pill works by inhibiting ovulation and interfering with fertilization by slowing the transport of sperm. 1 or 2 pills, depending on the brand, containing a high dose of levonorgestrel, a progestin, are taken anytime within 72 hours or 3 days of unprotected coitus to successfully interrupt a pregnancy. IUD. It creates changes in the endometrium and cervical mucus to slow or prevent sperm transport. A copper IUD is a small device with a fine copper wire wrapped around a plastic frame. It's placed inside the uterus to prevent pregnancy. Ulipristal acetate requires a prescription and may be taken as late as 120 hours or 5 days after unprotected intercourse. The ulipristal acetate is also known as ELA-1. It is used by women to prevent pregnancy after birth control failure, such as a broken condom or unprotected sex. This medication is an emergency contraceptive and should not be used as a regular form of birth control. Advantage: only methods a couple can use to prevent pregnancy after unprotected sex. Provides emergency treatment for victims of sexual assault. Disadvantage: neither method provides protection from sexually transmitted infection or the STI. Emergency contraception can be expensive and hard to get in some countries or for some women. And it has a limited time frame of 5 days following sexual intercourse. Here are the side effects of emergency postcoital contraception. We have the nausea or vomiting, dizziness, fatigue, headache, breast tenderness, bleeding between periods, or heavier menstrual bleeding. And the last one is the lower abdominal pain or cramps. Ulipristal acetate requires a prescription and may be taken as late as 120 hours or 5 days after unprotected intercourse.
Future trends in contraception. Studies are being conducted using even lower doses and different forms of estrogen. Biodegradable implants that do not have to be removed or an estrogen-based gel that is rubbed into the skin may be used in the future. They are the example of future trends contraception. A progesterone-filled vaginal ring that is permanently implanted is also possible. A birth control vaccine consisting of antibodies against human chorionic gonadotropin hormone is a distant possibility. Injection of testosterone for males, which halts sperm production just as estrogen halts ova production in women, are being tested in major centers. Ideal contraceptive: completely safe, no side effects, low cost, easily availability, easy reversibility, user acceptability.
Active termination of pregnancy is a procedure performed by an eligible healthcare provider to end a pregnancy before fetal viability. So an elective abortion or voluntary abortion is the interruption of pregnancy before the 28th week of gestation at the woman's request for reasons other than maternal health or fetal disease. So the most abortions done today are elective, and those it is one of the most frequently performed medical procedures. Reasons that elective terminations are most often requested for a pregnancy that first is threatens a woman's life, such as pregnancy in a woman with class IB heart disease. So, if the pregnant woman told to her doctor that she needs to consider ending a pregnancy for health reasons, so that is called therapeutic termination. The mother has the right to abort the fetus that has a medical condition which is certain to result in death either before or shortly after birth. And also, it is allowed if the mother risks death by continuing the pregnancy, like for example, if the mother has the heart problem, so that is recommended if the mother's life is in danger to continuing the pregnancy. Second reasons is involve a fetus found on amniocentesis to have a chromosomal defect. So if the pregnant woman knows about the condition of her baby, such as a fetal abnormalities or birth defect, such as Down syndrome, cystic fibrosis, or spina bifida, so the mother has the right to stop the pregnancy or abort the fetus because she thinks about the So reason number 3 is unwanted because it is the result of rape or incest. So if the woman get pregnant caused by the sexual abuse or rape, so that is considered to terminate or abort the fetus to prevent or avoid the trauma of the rape. Reason number 4 is unwanted because the mother is not ready, financially unstable. So dito naman, ito yung mga babaeng maagang nabubuntis, hindi pinapanindigan ng kanilang mga partner o hindi pa handa maging isang ina dahil sa financial status. Dahil sa hindi nila alam kung saan sila kukuha ng pera, panggastos tulad ng panggatas ng bata, at kung ano-ano pang kailangan para buhay ng bata hanggang sa paglaki nito. Unsupervised abortion carry a high risk for infection or excessive bleeding that can lead to death. The maternal mortality rate for elective termination is only 0.6 per 100,000 procedures. This rate correlates to elective termination being about 11 times safer for women than childbirth, for which the mortality rate is closer to 6 per 100,000 births. Elective termination of pregnancy will be unnecessary if woman acted within 120 hours of an expected coitus to take emergency
medically induced termination. Abortion can be done using these medicines. These are mifepristone, methotrexate, and misoprostol. Mifepristone, also known as RU-486, is a progesterone antagonist that blocks the effect of progesterone, preventing implantation of the fertilized ovum and therefore causing the pregnancy to be lost. It should be taken before 63 days of gestational age with single oral dose. And misoprostol is an effective cervical ripening agent to first trimester surgical abortion. It is recommended especially for women between 12 and weeks of gestation, adolescent, and for women in whom cervical dilation is expected to be difficult. How mifepristone and misoprostol work? Sa mifepristone, ang kadalasan umiinom ng mifepristone ay yung mga babaeng buntis na gustong ipa-abort ang kanilang baby. Dahil ang epekto ng mifepristone ay ginablock niya ang progesterone para hindi magtuloy-tuloy ang paglaki ng isang bata. Ang progesterone ay isang hormone na kinakailangan ng buntis upang magtuloy-tuloy ang paglaki ng isang bata. Ang misoprostol naman ay nag-trigger ng muscle contraction at ginasoften at ginadilate ang cervix, at kapag nag-contract na ang uterus, tuluyan nang ma-expel ang baby. Potential risks include incomplete pregnancy, an ongoing pregnancy, heavy and prolonged bleeding, infection, fever, digestive system discomfort. Signs and symptoms include heavy bleeding, severe abdominal or back pain, fever lasting more than 24 hours, foul-smelling vaginal discharge. Causes: nausea, vomiting, fever, chills, diarrhea, and headache. Those are the potential risks, signs and symptoms, and causes of mifepristone. And last is the methotrexate. Methotrexate is used to end ectopic pregnancy or trophoblastic disease. Tumors develop in early pregnancy, interferes with the DNA synthesis of dividing cells, and so prevents growth of the zygote. Ang methotrexate naman, ang kadalasan umiinom nito ay yung mga babaeng buntis na may ectopic pregnancy or trophoblastic disease. Side effects of misoprostol include diarrhea, abdominal pain, headache, anemia, nausea, vomiting, rupture of uterus, aches or pain, and constipation. Medically induced termination of pregnancy is contraindicated if a woman has a confirmed or suspected ectopic pregnancy, only methotrexate is used and the woman needs additional follow-up, an IUD in place, a history of allergy to mifepristone, misoprostol, or other prostaglandin, a hemorrhagic disorder, or is taken concurrent anticoagulant therapy. Medical termination has two types. These are medical abortion and surgical abortion. A medical abortion is an abortion that is completed using a combination of medicines either taken orally or through the vagina. Ang medical abortion, ito yung process ng abortion na ang ginagamit ay ang mga gamot tulad ng mifepristone, misoprostol, at methotrexate. A surgical abortion involves a minor operation. Ang surgical abortion naman, ito yung process ng abortion na involved na ang operation. One of the example of surgical abortion is the vacuum aspiration. Vacuum aspiration can be done with local anesthesia, sedation, or general anesthesia, removes the pregnancy by gentle suction. Prepare the patient, administer pain medication before the procedure to have maximum effect. When the procedure begins, give prophylactic antibiotics to all women or therapeutic antibiotics if indicated. Ask the woman to empty her bladder. Conduct a bimanual exam to confirm uterine size, position, insert speculum, and observe for signs of infection, bleeding, or incompleted abortion. Narito ang mga hakbang sa pagsasagawa ng vacuum aspiration. Una, ang pamamaraan ay nagsisimula sa isang pelvic o speculum exam. Pangalawa, ang isang local na anesthesia ay tinutulog sa tabi ng cervix. Pangatlo, idinidilat ng isang klinika ang cervix gamit ang instrumento na tinatawag na cervical dilators. Ang cervical dilators ay unti-unting tumataas depende sa bilang ng mga linggo ng pagbubuntis. Pang-apat, kapag nakamit ang nais na dilation, ang klinika ay nagsasagawa ng aspiration at tinanggal ang pagbubuntis. Sa isang tahimik, hawak kamay na suction, aparato na tinatawag na iPass para sa isang manual vacuum aspiration, or sa pamamagitan ng isang dikuryenteng makina para sa electrical vacuum aspiration. Panghuli, matapos ang pag-alis ng pagbubuntis, maaaring piliin ang tagapagbigay na gumawa ng isang ultrasound at pinayagan ang babae na magpahinga. Ang vacuum aspiration ay karaniwan ginagamit sa Amerika. Sa Pilipinas naman, ang karaniwan na ginagamit ay ang curettage or mas kilalang sa tawag na raspa or carlitation. After the procedure, a woman may experience such: expect mild vaginal spotting, cramping for 2 weeks post-procedure. Caution: use sanitary pads rather than tampons and not to douche to help avoid infection. Avoid taking aspirins for discomfort as this can increase bleeding. Advise to take acetaminophen Tylenol instead. Reminders are: avoid heavy lifting or strenuous exercise for about 3 days, swimming laps, aerobics, running, basketball, cycling on hills, and jumping rope. Her usual menstruation period will return in 2 to 4 weeks. It's best if she doesn't have sexual interrelation until a scheduled check-up to avoid infection. She should advise her partner to use a condom to avoid a second pregnancy.
Medical elective termination procedures involves several different techniques depending on the gestational age at the time of the termination. Suction evacuation, procedure in which product of conception is sucked out from uterus with help of a cannula fitted to a suction device. This is the surgical operation that enables the remaining contents of a miscarriage within the womb to be removed. Narrow polyethylene catheter is introduced through the vagina into the cervix and uterus. The lining of the uterus that would be shed with the normal menstrual flow is suctioned and removed by the vacuum pressure of a syringe. The procedure causes only a minimum of discomfort, perhaps slight uterine cramps. DNC, or dilation and curettage. A DNC is a minor surgical procedure to remove tissue from your uterus. A gynecologist or obstetrician performs this surgery in their office or a surgery center. It's usually an outpatient procedure, so you can go home the same day. A DNC gets its name from dilation of the cervix. Your provider dilates or opens your cervix. Your cervix is the opening of your uterus where it meets the top of your vagina. Usually, your cervix only dilates during childbirth. Correct? The provider uses this thin instrument to scrape your uterine wall and remove tissue. Who needs a dilation and curettage? You may need a DNC if you have or had a miscarriage, leftover tissue in your uterus after an abortion, unexplained bleeding between menstrual periods. What are the risks of a dilation and curettage? Uterine perforation, a small tear in your uterus, which may happen if the tip of the curette passes through your uterine wall. Next is uterine infection and uterine bleeding. What happens before a dilation and curettage? Occasionally, before beginning the DNC, your provider may begin to dilate your cervix using a laminaria stick. They insert this thin rod into your cervix and leave it there for several hours. You can get up and walk around while the laminaria stick is inside. The laminaria stick absorbs fluid from your cervix. When that happens, your cervix opens and gives access to your uterus. Procedure of DNC. Insert a speculum into your vagina. This smooth device shaped like a duck's bill helps open your cervix. Use a clamp to hold your cervix in place. Make sure your cervix is sufficiently dilated, using a series of rods to open it slowly. Use a curette, a type of suction or scraping device, to clean out tissue from your uterus. And lastly, send a sample of the tissue to a laboratory for analysis. Next is prostaglandin or saline induction. It's a gel or vagina insert of prostaglandin is inserted into the vagina, or a tablet is given by mouth. This is typically done overnight in the hospital to make the cervix ripe. For delivery, administered alone, prostaglandin may induce labor or may be used before giving oxytocin. Is often the preferred method of inducing labor since it is the closest to natural labor. Next is hysterotomy. It's an incision made in the uterus. This surgical incision is used in several medical procedures, including during termination of pregnancy in the second trimester and delivering the fetus during cesarean section. Next is partial birth abortion. Refers generally to an abortion procedure where fetus is removed in pec from a woman's body. The procedure is described by the medical community as intact dilation and evacuation, or dilation and extraction, depending on the presentation.